Hello everyone. In the last two videos, we have covered the important points and MCQs in the concept of disease and health. Now let's move on to the topic in screening in community medicine. First, we'll go to the concept of screening of disease. First of all, if you take up of screening, you have three different types of screening. The first one is mass screening, high risk screening, and multiphasic screening. First, let's move on to the mass screening. The mass screening is done for the whole population. For example, the screening test done for carcinoma in breast, HIV, cervix, etc. The second one is high risk screening. High risk screening is done for certain group of population. For example, screening of defense people like high risk occupation, their age. Screening is done for selective occupation and age. Like the selective is done for high risk screening. Then the third one is multiphasic screening. The multiphasic screening is when the screening is done in steps. It's called as the multiphasic screening. For example, population, chronic cough, fever, and COPD or asthma, etc. This is called as multiphasic screening. Next, we will move on to the criteria for the screening test. The screening test should be affordable, acceptable, available, and having reasonable validity, accuracy, and precision. A screening test should have these three: validity, accuracy, and precision. Now let's move on to the properties of the screening test. Here you have two rules. The rule number one is disease should be always on the top. Then the rule number two is you should never cross the two sides of the table. Now just pause this video for a while and you need to by heart this table. You need to remember, if you remember this table, you can answer many MCQs in the MCA exam. There are 6 formulas in the properties of the screening test. Let's move on to the formulas. The first one for sensitivity. The sensitivity, the formula is true positive divided by D plus. Then the second one is specificity. If they ask you to find the specificity, the formula is true negative divided by D minus. The third one is false positive error rate. The false positive error rate, the formula is 1 minus specificity. The fourth one, false negative error rate. The formula for the false negative error rate is 1 minus sensitivity. The fifth one is PPV value. The PPV value is positive predictive value. For that, the formula is true positive divided by T plus. Then we will move on to the NPV, negative predictive value. For the negative predictive value, the formula is true negative divided by T minus. Now we will move on to the screening test and diagnostic test. For the screening test, we use the sensitivity, and then there should be a low false negative. This is the true criteria for the screening test. Then we will move on with the diagnostic test. For the diagnostic test, we use the specificity, and there should be a low false positive. This is the true criteria for the screening test and diagnostic test. Then we will move on to the likelihood ratio. If the examiner asks, tell me about the likelihood ratio. Likelihood is nothing but chance of having the disease. The chance of having the disease is called as the likelihood ratio. So you shouldn't get confused with likelihood. It is a new word to me. So chance of having the disease is called as the likelihood. So here we have likelihood ratio. We have two formulas. Likelihood ratio R positive and LR negative. For the LR positive, the formula is sensitivity divided by 1 minus specificity. Then for the likelihood ratio negative, the formula is 1 minus sensitivity divided by specificity. Now let's move on to the ROC curve. ROC curve is nothing but receiver operator characteristic curve. Let's move on with the example of this curve. If we take this curve, in y-axis we have sensitivity, and in the x-axis we have 1 minus specificity. 1 minus specificity is nothing but it is the false positive rate. False positive rate. Here the examiner can ask what is the best screening test or the best curve. For the best screening test, there should be higher sensitivity. This is the two criteria. There should be a higher sensitivity and there should be a low false positive rate. If the curve is highest, it has the highest among the y-axis, then that curve is the highest in sensitivity. Then if it should have low false positive rate, that means the curve should be more towards the left side. So here we have three curves. If we take the B curve, it has the high sensitivity and the low false positive rate. And if we take the A curve is less sensitivity among the B and C, and it has the second low false positive rate. And if we take the C curve, it has the highest sensitivity, but the false positive rate is more. It is more towards the right side. So it is not the best curve. So here the answer is B curve is the best screening test. Why? Because the B has the higher sensitivity and it has the low false positive rate. The curve is more towards the left side. So B is the answer here. If they give some curves like this and in your MCA exam, you need to answer accordingly. If you remember these two things, the screening test should be higher sensitivity and the low false positive rate. If you can answer this question. Now we will move on with the false positivity determinants. If the question is, if they increase the value of false positive, if they increase the value of the false positive, they will ask what remains the same and what will increase and what will get low. So you need to remember is, if they increase the false positive, there is a decreased specificity or decreased true positive, and next is low prevalence, and the last one is increased sensitivity. So increase in false positive, if they ask increase in false positive, you need to remember decreased specificity, low prevalence, and increased sensitivity. You need to remember this three things. Okay. I need in this video you need to memorize some of the tables and some of the formulas. If you remember it, you can answer in your MCA exam. Hope this video will be useful to you. Thank you. All the best. Stay happy. Stay healthy.